We have now left a little bit more than 10 minutes for the discussion, for the panel discussion, and you, dear Mr. Stender, and you, dear Mrs. Heuer, have kindly prepared also to stay with us here now. So the discussion is of course now starting and open. Please, all the participants, feel free to use the microphone, to raise your virtual hand so that we can discuss in a more or less organized form, and it will be great to get your input. There was one comment already by Bernd Kümmerlen that referred to the speech of Mrs. Heuer, and maybe we can pick that up first of all and then just jump into the further discussion, of course. Mr. Kümmerlen, would you like to express yourself the topic on that, let's say, basic UDI-DI aspect?
Yes, I can. Can you hear me?
Yes, fine. Good.
Okay, so yeah,
good morning.
The question was about the UDI-DI, and there were these characteristics or the same essential design and the same manufacturing characteristics topic, which I understand for hardware medical devices will probably be an issue in a lot of cases, but I was wondering about software as a medical device, where you usually have basically the same manufacturing characteristics because it's just code, and also probably the same essential design if it's based on the same code base. So can you comment on that, if that is a correct assumption?
Yes, so actually in the meantime I went back to our specialist because I'm not a softie, so I had to ask the expert, and basically there is a difference, of course, between the manufacturing and the design, and he replied, so basically under his assumption the same manufacturing characteristics can be understood as coding language, compiler, etc. And if you have, for example, the when it comes to design, it depends on the algorithm. So maybe that is something I can give you currently as an explanation, and I do not have more deep down information on the very specifics and differences depending on what kind of algorithm design you are using, if you can compare it to each other, because that essential design is, as I mentioned, a little bit vague defined. So at the end of the day, it may come to the point where you have to decide, I see it as essentially the same, or it is a huge difference. Does that help?
Yeah, thank you. That helps.
Okay.
Thank you so much. Thank you so much, Mrs. Heuer. Great. A further question has just appeared in the chat from Umesh Satyal. It's about the data related to clinical evidence, I think. Were existing clinical data sufficient to transition from MDD to MDR? I think Mrs. Heuer also already has summarized the experiences on the assessment of the documentation with that regard. But it's maybe a question that could be discussed again, an interesting question by both of you, Mrs. Heuer and Mr. Stender too, because with that transition and update to the MDR, what approaches were applied to comply with the clinical data requirements under the MDR? What can be said about that?
So maybe if Mr. Stender wants to complete out of his manufacturing experience as a notified body, actually if you have existing clinical data, of course they shall be utilized. So what we have experienced, that these data have not been collected in enough evidence, meaning that the data have not been recorded so that you can say who and when and under which condition these data have been collected, and then there was the lag to comply with the MDR requirements. So it depends, of course, on the quality of data you have collected. But maybe Mr. Stender can add on that. as well, his experience.
Yeah, I'm definitely not an expert on these topics, because all these works is done in the let's say product projects, and so I'm not so deeply into these topics. So, but my assumption definitely is the same. It depends on how good the product data was before, how much effort you have to put into the transition from MDD to MDR. You definitely have to do something. That's for sure. But depending on the quality of your data, you have to do more or less.
Yes, yes. Thank you. Thank you so much. Maybe again to a question towards you, Mr. Stender, because you are, as a Dräger representative, acting as a global player, and you also mentioned that of course the whole, let's say, adjustment to the MDR had a lot of consequences and effects also on the whole international, let's say, level and international association of all the affiliations and locations of Dräger. To your, let's say, also with regard to all the project experience you have now, you mentioned you have more than 300 requirements that were identified that had to be, you know, somehow implemented with regard and adjusted with regard to the update to the MDR. Where do you see, let's say, the European MDR in comparison with the international requirements in so many countries where you are represented? Would you say, okay, the MDR, because also other countries, I mean, Canada, Australia, United States, of course, China, I mean, they also, you know, they are advancing with regard to PMS, UDI, and so on. A lot of things are coming up. Would you nevertheless say, okay, European MDR is really, I mean, now the most sophisticated, let's say, regulatory system, and so many had to be adapted to that now? Or would you say, okay, this is a international flow of activities where it's just, you know, one part of many others?
Well, I would say Europe is definitely one of the most challenging landscape so far. I think otherwise we wouldn't have so many requirements where we say, okay, we need to do something. I mean, we were a player in the global market for quite a long time, and if we found out that there were more than 300 things we need to address within our company, then this is definitely an indicator that this is well above everything else in the world right now.
Mm-hmm. Yeah. Thank you so much. Maybe another aspect with regard to the bottleneck notified bodies, and also the whole aspect with regard to the remote audits. A question to you, Mrs. Heuer, maybe primarily. We heard that industry and also notified bodies are reporting of a certain bias among the European Union member states, telling that some designating authorities would be more open for remote audits during the COVID-19 pandemic, and others would not. And we also heard certainly, and especially Germany, Italy would be not so open, and others would allow, let's say, more freedom with that in that context. So what is your opinion on your experience on that? I mean, it's also a question with regard to harmonization of the notified bodies' activities, right? Which should be a goal in the European Union, but we hear a lot of, you know, more or less, critical voices about that too.
Yes, so that I can confirm that there has been a lot of discussion on EU level. You can imagine there is like a big circle of all the member states, and every one of them has its own opinion. And Germany is usually very also strict to the law. I think that is not a secret, and they anyhow, you mentioned the harmonization approach. They try to find one harmonized understanding of the situation. So as when I mentioned that we have, for example, to support remote audits, which are then the the basis of any kind of initial certification towards MDR or IVDR, all of the notified bodies in Europe has to do so. So there has been created a template where we enter these kind of information, and that template is then, and our record is then sent with all of the other records of all other notified bodies in Europe into a database on European level. So the Commission can access that at any point in time. If there is now more remote audits, if, for example, in Netherlands allowed, I cannot tell because we don't have access towards that. So it is very hard for us also to see the differences in other member states if it is not told to us, and then is of course of data security and so on. So you hear only rumors and voices, but currently I think they have been a little bit harmonized, their approach. And if there is a major imbalance, I think there's then the need to further discuss on that topic.
Mm-hmm. Mm-hmm.
But I think there are more examples where the European countries do not act in the same way. So for us, for example, the EUDAMED actor registration module was a big example, which was integrated or implemented in December. And in some member states, it was allowed to register and you receive your SRN, and in other, it wasn't. So in Germany, it wasn't allowed. But I think in France also, they could register from the very start on and receive the SRN, start with other processes. And I mean, for example, for Dräger, this is not a big problem for us. But if I were a company providing authorized representative as a service, and I'm not registered in EUDAMED, maybe some companies looking for an authorized representative didn't found me because they look in EUDAMED who's registered to get in touch with them. So for them, I would say it's definitely a problem. For us or for Dräger as a manufacturer, this was not a big problem. Maybe for other manufacturers this is, but this is a picture for me stating that the MDR and everything here is not really that harmonized as we maybe thought it should be.
Would expect it. Yeah, thank you so much for that contribution. That's true. Maybe EUDAMED is again one final good point that you just picked up. We have heard about the actor registration module and the postponement of further modules again and again, which will probably bring further problems, of course, to all the stakeholders. Just one question maybe to our dear colleagues from the competent authority. We have in our list also some participants from the competent authority for market surveillance here in Schleswig-Holstein. Maybe we can just quickly ask about the current state of the play. So did Schleswig-Holstein now validate, or were they able to validate then completely, or were there again any barriers or any, let's say, doubts that came from the Federal Ministry of Health? Just if you want to say anything about that here in the discussion panel.
Yeah, so, I'm not sure if I'm fully aware of the current situation, and but everybody is encouraged to use these playgrounds, and also for the testing phase, the notified bodies will come together, for example, to test in a group. So with the next approach, so to really harmonize also the understanding, because it does most likely not make sense to do it as an individual notified body each, but then to harmonize also the understanding of the system. And you're also correct, there is sometimes open questions out of MDR, and the different articles and annexes are then coming up with EUDAMED, and within the specification of EUDAMED, maybe you think you answered actually a question from the law, and then they say, no, that is incorrect, that is an error in the text spec, and then yeah. So you go the circle around. So the manufacturer has the question, but you can be assured that a notified body has the same questions. And yeah, it is a very good question. But as Mr. Stender said, if it is possible, try to be part of the discussion up front, so you have more insight, and you can maybe amplify then your knowledge beside only reading. I mean, I'm also not a person only reading. Reading does not help me at a certain point in time. You really need to do practical things and need to talk with others. So these kind of exchanges may more help than actual only reading.
Right. Thank you so much. Yeah, I think maybe Mr. Stender, did you have another point, or that's fine? All right. So I think that was really maybe also good.
May I come back to your first question?
Yes, yes, please. Yes, please, Mrs. Hasselbring. Thank you.
Yeah.
Thank you.
Yeah, regarding the UDAMED registration, we are registering now, and well, we give some give some aspects back, because if there is something missing or something like that, then the operators get their application back. But usually we try to get fast forward with it.
Yeah, and I can confirm this. We received our SIN, I think, 27th of May or so.
That's great. Thank you so much also to Mrs. Hasselbring. Thank you so much. That's also a good experience and feedback report here. Good. Yeah, I think the last point with regard to information exchange, communication, transparency. This is something really most relevant, as you just pointed out, Mrs. Hoyer, Mr. Stender, to be able to implement the tricky and demanding aspects with regard to many MDR requirements. Needs really information exchange, needs a lot of guidance, and needs transparency, and especially for those that maybe are not part of any specific committees or any specific, exchange platforms. They are really dependent on that and that communication information. I think that could be maybe a good, let's say, interim message for the today's meeting. We have to stay somehow in time, and that's why we, I think, should go now into our lunch break.